So you can start.
So, on behalf of PRF West Bengal, under the aegis of Association of Physicians of India West Bengal branch, we are really delighted to have you all in today's online workshop on good clinical practice. And I think we are really privileged to have with us our mentor, our guide, Professor Jyotirmoy Pal, sir, who needs no introduction. Sir is the President of Association of Physicians of India. So may I now request Professor Jyotirmoy Pal, sir, to inaugurate today's workshop on good clinical practice. Welcome, sir.
Good afternoon. I welcome all the delegates, students who joined the course of good clinical practice organized by Physician Research Foundation, West Bengal branch under API, West Bengal. The day I take the chair of the President API and Dr. Muruganathan as the Director, Physician Research Foundation, we decided that research is our priority. If you go to abroad, Indian doctors, students are highly appreciated for their clinical skill and teachers for the clinical teaching. But in one aspect, India lags behind, that is the research. Because of the huge patient load, maybe some lack of infrastructure, our research avenues or the interest among the doctors not very high. So we decided first we should create or generate interest among the youngster so that in future they at least they can spend 10% of their time for the research, and at least after maybe after 20 years, 30 years, 50 years, that there will be reversal of the scenario. The now India makes its guideline based on the Western data. They may come when the Western countries will make the guideline based on the Indian data, and that is our dream. To fulfill this dream, first we learn the methodologies, and GCP training is very mandatory because how we'll proceed, we should know the pathways, then we can work only. So GCP training, then the classes on the medical statistics, then research methodology, and finally how to write the articles, publication. I told Dr. Shambhu Samazdar, he is a youngster, very energetic. He is convener of our PRF wing West Bengal. I asked this course periodically. Single course is not enough. So periodically you conduct these courses so that our youngster become a very good researchers, and our aim and dream will be fulfilled in near future. So thank you. Over to Dr. Shambhu. Please proceed. I wish all success of today's webinar. Thank you.
Thank you very much, sir, for your blessings and your wisdom. And now we have with us Professor Partha Sarkar, the chairman of Association of Physicians of India West Bengal branch. So now may I request Professor Partha Sarkar, sir, kindly give your valuable address.
Thank you, Shambhu, for inviting me to address this very important training program, GCP. I am proud that as a chairman of the API state chapter, we have started our PRF forum in 24th July, August. We have started this thing, and with your active participation and as a convener of this PRF and also Dr. Uttam Pal, we have formulated the different program that in future we'll undertake. And to begin with, you are doing this GCP, good clinical practice, which is a basic necessity to undergo any clinical trials. Basically, GCP has to be learned by all the researchers who want to do research, because this is the set of international guidelines to have a very safe and integrity of the clinical trial. And these GCP also take care of the participants' privacy and safety. And GCP is also very important regarding the data integrity, informed consent, then mainly the ethical issues of participants' dignity and rights. So all these things a researcher must know before doing a research, along with very important second point, before undertaking any research activity, we must know the risk benefit ratio. Only if benefit is there and risk is lesser than the benefit, then that should be undertaken. And there should not be, we cannot do, if we cannot do any benefit to the patient, we cannot do any harm. So you have to select those things. So there are 10 or 12 basic principles. Out of them, mainly the ethical issues, safety, informed consent, integrity of data. These are very important things. I think the speakers afterwards will discuss in details about this. I wish West Bengal chapter is first. I think first 2 or 3 states have just started the PRF at state chapter. We are one of them. I am very happy that our PRF members, mainly the secretary chairman, is very active to take different programs. And I hope all the success of this program. We have already registered almost nearly 500 delegates have registered. So it's a very good beginning. I wish all success of this program. Thank you. Over to Shambhu.
Thank you very much, sir, for your kind introduction and your all guidance always. And I think due to some technical glitch, our PRF chairman, Professor Uttam Pal, cannot be joined. We will wait for a few minutes. But before that, may I address all the respected delegates who are attending today's program.
Dr. Muruganathan has not joined?
No, there is some issues in his devices. So we can wait for them, and also we are waiting for Professor Nandini Kumar, also the president of FARSI, Forum of Ethics Review Committee of India. So she also trying to join. But the thing is that as it is almost 1:40, within 5 minutes, all the respected delegates, you will receive one Google form that is a link for pre-test questionnaire. So there will be 10 questions. I am requesting you all, please give your answer in that through that Google form. And because you know that GCP certification workshop is a serious workshop, we need the pre-test and post-test question submission appropriately. Very soon, the Clarnet team will provide their through their mail IDs and through also this channel via their channel the link for pre-test questions. So please submit your pre-test, and with that we will wait for maybe a few minutes for our other respected dignitaries, and then we'll start the scientific session straight away from 2 p.m. So please wait and be prepared for the pre-test question. So Team Clarnet, I am requesting you to submit the pre-test question.
Yes, sir.
by another 5 minutes.
Sure.
To all the delegates who had registered, please submit pre-test question. So we are really delighted to have with us Professor Uttam Kumar Pal, sir. Professor Uttam Kumar Pal, currently the chairman of PRF West Bengal branch. So welcome, sir. And we are waiting for your welcome address, sir.
Thank you. This is our first initiative for the Good Clinical Practice GCP. This GCP certificate is required for all the PGTs for their university examination. Welcome all in this session. Thank you all.
Thank you very much, sir. One thing I just want to ask you, because I think we have a little bit more time also, because from the field of internal medicine, you were one of the person who had a huge experiences with qualitative research. So can you tell us very quickly, briefly, what are the very important ethical issues? Because that is something we cannot have the opportunity to understand in our day-to-day GCP workshops. But as we have you as our chairperson also, chairman also PRF. So can you please little bit tell us about the ethical aspects of qualitative research?
Regarding two types of research are there. One is quantitative and one is qualitative. In qualitative research, we actually accept the patient's experiences, their views, their perceptions like this. Here only what they are saying. We are there seeing what are the result of their speech, what is the result of their experiences, what are the result about their views. Usually we take this. Regarding all types of research, ethical principles are all same. That is beneficence, non-maleficence, respect, trust, all these things. And anonymity must be there. So regarding ethical aspect of qualitative research, it is not any different issue. It is the same issue like that of any type of research. This much.
Thank you, sir. Thank you very much. I think you had clearly mentioned, because as in the qualitative research, we will need to do some focus group discussion. So the anonymity is very important. We need to take care of those issues, especially while we are recording those interviews and we are
And one
keeping
thing
them in
that is
our archive.
informed consent also. Informed
Yes.
consent must be taken.
Yes. So thank you very much,
Thank
sir.
you, Shambhu.
Once again, Professor Uttam Kumar Pal, sir, for your kind presence. Now, may I request our Clarnet team to proceed for the pre-test question, and please give that Google form to all our delegates, and then at 2 p.m. Please start the first presentation.
All right, sir.
So, dear delegates, please be prepared for our pre-test question. There will be 10 questions. You will get 5 to 10 minutes time. Please submit your responses. Thank you. I hope all of you have received the pre-test questions through mail and through the this link also. So, and we can wait for another 2 or 3 minutes. Then we'll start today's sessions. So, Team Clarinet, hopefully you had also shared the link to this delegate link also.
Yes, sir.
Okay. So, as it is almost 10 minutes past from the pre-test question, so I request you all to submit it. And now we'll start today's technical session. So, Team Clarinet, may I now request you start the technical session. Please proceed.
Sure, sir. So now I would like to invite Dr. Shambhu Samasda sir. He will be the first speaker of today's session. And sir holds degrees in MBBS, MD, DM in clinical pharmacology, PGDIP Endo and Diabetes, RCP from UK, Diploma Allergy Asthma Immunology Gold Medalist, Fellowship in Respiratory and Critical Care, Fellow of Allergy Asthma Specialist Course, Sir is General Secretary of IPS West Bengal. Yes.
May I want, yeah. So thank
Sure.
you for just, we are really privileged to have with us now Professor Nandini Kumar Madam. Madam, welcome. As we are really proud to have you with us, and Professor Nandini Kumar Madam is currently the President of FARSI, Forum of Ethics Review Committee of India. And we can say Madam is mother figure in the field of research ethics in India. We are really thankful, Madam, that you gave your time for us. May I now request you to please address our delegates who are attending today's GCP workshop with your wisdom.
Thank you, Dr. Shambhu, for introducing me. GCP, of course, is a very important aspect, not only for those who are actually involved in interventional studies, but also outside that. And this, the latest revision of good clinical practice, of course, it has to be called good clinical research practice, but we all know that it is a short form GCP. We all know now with the latest revision also that the burden is now shifted to many stakeholders. So it is important to know what are the changes and what is the latest in the scenario. And I wish you all a successful program today. And I'm sure there are good speakers there. I'm sure that you'll benefit from that. Over to you, Shambhu.
Thank you, madam. And I also request you during our panel discussion, if you also stay with us, because we also have the Professor Shantanu Kumar Tripathi sir at that time. And we'll be really delighted to have you, because our delegates who are there, they can ask question to you. So I request you at the time of panel discussion around 5:30 p.m. Please
Yeah,
be with.
yeah, I'll try to sit through. I'm having some connection problems. So,
Okay.
uh, as long as I have no problems, I'll be there.
Thank you, madam. Thank you. Now we will start today's technical session. May I request the team planner to start my presentation, please?
Sure, sir. Sure.